Much of the federal government's approach to COVID until now has been based on modelling provided by the Doherty Institute. The Institute's Professor Sharon Lewin joined me a short time ago. Professor Sharon Lewin, last month some Doherty Institute modelling was leaked, which suggested that we could reach 200,000 cases a day by the end of January. Now, I don't want to ask you to comment on those figures since they were a leak from National Cabinet, but they just provide a bit of context for considering what's happening now, I suppose. Today, we're just short of 50,000 cases after a 25% increase from yesterday. What's your feeling about where the numbers are heading?
Well, the numbers are showing no signs of slowing down, unfortunately, and we're seeing these really brisk uptick in numbers that has been observed in many other parts of the world. And other places have reported, doubling times in 2 to 3 days. So I suspect we're going to keep seeing those numbers go up, unfortunately.
200,000 doesn't sound like it is sort of all that far out of the ballpark if the rate of increasing continues.
Agreed. If we don't do anything different, I don't see that that's going to change terribly.
What needs to change? I mean, you've talked in recent times about you pushed back against the sort of easing of restrictions last month. Some of those have been reintroduced, like masks and QR codes. What more needs to be done if we want to flatten that curve a little bit?
Well, there are additional public health restrictions that could be considered, things like density rules and risk mitigation strategies for large events, or even limiting large events. That would be the next route of intervention that would be possible. We've now begun to heavily rely on antigen testing, which I think makes sense when we have such big numbers, and the shortage of antigen tests are a real problem at the moment. And I think also access to those tests really has to be free. We have a public health system in Australia, which is the beauty of our healthcare system and is the absolute plank of our public health approach. Free access, equitable access for absolutely everyone. So the fact, if we're going to rely on antigen testing, and I think we can do some really innovative things with antigen tests, it may even give us additional freedoms in certain situations. They really have to be widely accessible and free.
How worried are you that because of the way the pandemic is playing out, we're getting an erosion of the quality of data about how big the infection base is?
Yeah, I'm more worried about what to do with the positive test and therefore guidance to a person that's infected and guidance to their contacts. That's what's really important here. The collection of, there's other ways we can do surveillance without testing absolutely everyone. It's a different way of how we count numbers to what we've been doing over the last 2 years. But I think there are other strategies that we can do to get a good understanding of total numbers of cases. Having said that, total number of cases are really important because they guide us on what the relationship between cases, infections and deaths are, and therefore where to target our interventions. So having accurate data is really important. There are ways that we can do that with antigen tests, and there's also other ways that we can track data, which is different to what we've been doing over the last couple of years.
So how concerned are you about what's happening in ICU wards and hospitalisation rates and how sustainable that is?
Yeah, I'm getting increasingly concerned about pressures on our healthcare system. Numbers of hospitalisations are increasing. They're not increasing at the same rate as in previous waves. A lot of emergency department attendances, which is causing significant stress on the system. And most importantly, our healthcare workers themselves are not only exhausted after 2 years of working with COVID, but many of them themselves are getting infected now, usually through social contacts because it's so prevalent in the community, which puts extra pressure on the people who are not infected. So there's real concerns that we must look after our healthcare system. They've really been pushing at it for a long time now.
Well, Doherty modelled a path out of the pandemic and into living with COVID last year. Has Omicron basically just blasted all of that out of the water? What has changed since you were modelling that in the middle of last year?
I don't think Omicron has changed the principles. The principles are that you need high levels of vaccination, public health measures and test, rate, isolate and quarantine in order to keep transmission potential low, or the goal was less than 1. Now, Omicron is totally different to Delta. The vaccines are less effective. It's far more easily transmissible. And once you have huge cases, you can't use the same systems we used previously for test, trace, isolate and quarantine. So the principles are still the same, but yet the way we use each of those 3 levers has to change. And I think one of the main messages from that modelling was we must use all 3 levers: vaccination, public health social measures and test, trace, isolate and quarantine, and they will change over time. And Omicron has delivered that change that we have to respond to.
In some ways, it's sort of brought on the sort of changes that we have talked about needing to make.
That's right. I mean, the good news of Omicron, if there is good news, is that certainly hospitalisation, the link between cases and hospitalisation and ICU admissions has definitely been broken further with Omicron. We also have boosters, which can further enhance our vaccine effectiveness. However, I think one area that people are struggling to understand is once you have very high cases, you do need to use different strategies to isolate and quarantine people. You've got to simplify that much more, because health departments can no longer do this for tens of thousands of cases. And that's really where the role of antigen testing and self-determined isolation and quarantine comes in. It really is the only way we can do it once you have such high numbers of cases.
Sharon Lewin, thanks once again.
Thanks very much, Laura.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.